Good morning, I'm Adhikari. Welcome to our first TV USA. Here is the breaking news. India will witness a peak in the number of COVID-19 cases by next month with the expectation of reporting 5 lakhs cases per day. A US-based health expert said, adding that however the severity of the variant will be less this time in the country than Delta variant. Dr. Christopher Murray, Director of the Institute for Health Metrics and Evaluation and Chair of the Health Metrics Science at the University of Washington, said, "You are entering the Omicron wave, as many countries around the world are, and we expect that there will be more cases per day at the peak than you had in April last year for the Delta wave. But Omicron is much less severe. So, while you will have many cases and records probably for cases, it should be less of an impact on the severity of the disease. We currently have in the models that we will release later. We expect about 5 lakhs cases at the peak, which should come in during the next month," he added. As many experts in India say that the country has hybrid immunity due to which Omicron will be less effective. Dr. Murray said, "What we know from a place like South Africa, where there was a tremendous amount of prior infection, both Delta as well as Beta vaccination doses provide considerable protection for severe disease from hospitalization and death, which is why we think there will be many Omicron cases in India, but much less hospitalization and death than you had in the Delta wave." Speaking about the number of hospitalization and severity due to the variant, he said, "We expect that 85.2% of infections will have no symptoms. They will be asymptomatic, but amongst the cases, we still expect quite a number of them to end up in hospitals, and in terms of death, cases will be much reduced. So, we expect that the peak of hospital admission in India will be about a quarter of what you had for the Delta wave, and deaths should be less of what you saw for Delta." According to some experts, further spread of Omicron may lead to other mutations. Talking about it, Dr. Murray said, "The thing about mutation is that they are random. So, the more transmission there is, the more potential there is for mutation to occur. But in the setting of this rapid transmission of Omicron, it is going to be very difficult in the next month or two for a new variant to meet Omicron because it is so transmissible." Dr. Christopher Murray further spoke over the new variant with multiple mutation in France. There are mutations all the time, and you can identify variant with many mutations, but the thing that we look for is that within 30 to 45 days after a new mutation appears, has it spread? Has it spread like Omicron? So far, that mutation has been around for quite some time in France, and it has not spread, so we are not currently learned about that mutation. Omicron is 90 to 95% less severe, but there is still a segment of individuals, particularly older individuals, who will get sick, so there will be an increase. It is just a much smaller increase in hospitalization, he said. Beyond the report for TV USA.